Good morning, everyone. Thanks for being here. Rob Bonta, California Attorney General. And I want to say thank you for your presence as we announce a critical step in protecting some of the most vulnerable Californians and preserve the integrity of our healthcare system. We're here today to talk about hospice care and hospice care fraud, which is running rampant, unfortunately, in California, particularly in the LA County area. Hospice care is meant to provide compassion and dignity and peace in the final chapter of one's life. But today we're confronting a deeply disturbing truth that hospice fraud has become a full-blown epidemic in California. That's why I'm proud to announce the launch of my office's Hospice Fraud Initiative, a comprehensive effort to crack down on fraud, hold wrongdoers accountable, and stop exploitation before it begins. Our message today is clear: abusing a system meant to bring care and comfort and putting profits before patients and their families won't be tolerated. And it won't fly under the radar. We'll hold those attempting to defraud our healthcare system accountable. At the heart of this initiative is a simple principle: people deserve to be protected, not exploited, in their most vulnerable moments. In the greater Los Angeles area, particularly in Van Nuys, Glendale, Burbank, and North Hollywood, we're finding that hospice fraud has been a pervasive issue. It's so widespread that the Department of Healthcare Services had to impose a statewide moratorium on new hospice licenses in October 2023, which moratorium remains in effect until at least January 2026. The scale of this problem is staggering. Hospice fraud has drained far too many resources from California's Medi-Cal system. We've uncovered a few of the more obvious red flags through our investigations. Hospice providers are billing insurance for people who don't even exist, also known as ghost patients. They're enrolling patients who are not terminally ill. They don't need hospice care. There's been no diagnosis, no prognosis for these patients. They're signing up multiple patients at the same address. They're enrolling patients who live far outside the service area. And in some cases, hospice providers show extremely high rates of live discharges, or patients who stay on hospice for well over a year, which simply doesn't align with what true hospice care is. This isn't just abuse of our healthcare system, it's a cruel manipulation of both patients and their families seeking dignified end-of-life care. My office's approach to combating hospice fraud is both retrospective and proactive. On the enforcement side, we've launched numerous criminal and civil investigations. We've filed criminal charges against 109 defendants. We're involved in 24 civil investigations. We're working hand in hand with federal agents and other state agencies. And we've conducted dozens of knock-in talks with suspicious hospice storefronts across Glendale and Burbank, literally knocking on doors, talking to people, asking questions, learning more. This fraud isn't just about dollars lost. It's about real harm to real people. In one of our cases, for example, the owner of a hospice company was keeping 6 elderly and severely disabled residents in an unlicensed facility. Riverside Police found them living in unlivable conditions, without basic care, malnourished, and clearly neglected. The owner was using them to bill Medi-Cal for hospice services that were never provided. When police arrived, all 6 had to be hospitalized immediately. In another instance, a Medicare patient was enrolled in hospice without his knowledge or his consent. When he went to see his nurse practitioner, the bill for the visit was denied, and he was told it's because he was already in hospice care. That meant his primary care office couldn't treat him, where he could actually get real health care that he needed. He was left without his regular doctor, stuck with the medical bill, and unable to get the care he needed. Also, someone else could profit off the system. These cases underscore why this work is so important. Fraud like this doesn't just cheat the system, it hurts patients and endangers lives. We're sending a message today: if you're committing fraud, we will find you and we will prosecute you. But enforcement alone isn't enough. That's why today's initiative also includes major proactive measures to educate, to engage, to stop fraud before it starts, including a consumer alert to help Californians spot and report suspicious hospice activity, outreach to local law enforcement, medical providers, and the public, and a public awareness campaign here in Los Angeles, including radio PSAs and a billboard you can see when you're driving on I-10, so Angelenos know what to watch for and where to go if they suspect abuse. I also want to take a moment to urge anyone who suspects fraud to report it at oag.ca.gov/DMFEA/reporting. We're here to help. We want to hear from you. Hospice fraud is a betrayal of trust. It undermines the care that families count on when they need it most. To those committing fraud, we are watching, we are investigating, and we will take action. I want to take a moment to recognize my hard-working team at DOJ's Division of Medi-Cal Fraud and Elder Abuse. They're on the front lines of this effort every day, and they've made this initiative possible. They've been getting after it, holding folks accountable. We know there's more to do, and that's why we're launching today's initiative. So I want to say thank you, and now I'm happy to answer any questions that you might have.